Hi, everyone. Thanks for joining us. So today I have Dr. Gantous, and he's from Toronto Facial Plastic Surgery Clinic. Hi, Dr. Gantous. How are you?
Well, thank you. How are you?
Good, good. Can you tell me a little bit more about what you do and how you got into plastic surgery?
Sure. I'm a facial plastic surgeon. I am trained in otolaryngology and head and neck surgery, long name for a big specialty. Um, and one of the subspecialties within my specialty is facial plastic surgery, and it's something that I've always liked. And basically, over the years, as a training and so on, this is the area that I gravitated to. I found it challenging and artistic, and that's sort of the reason why I ended up doing what I do.
So what's your favorite part about plastic surgery, or about plastic surgery of the face, I guess?
Yes, it's we basically just specialize in the face and neck and do all sort of procedures there, both cosmetic and reconstructive.
Okay. So do you have a specific, do you like doing, I don't know, rhinoplasties? Like, what's your favorite?
My favorite operation is rhinoplasty. It is you got it right. It's the most challenging operation that we do. All rhinoplasties are different. They're all always challenging. It doesn't matter how long you've been doing this. I've been doing this for 23 years, and I still find them challenging. I'm still learning something every time that I do one. So that's the reason why I like it the most. It's very three-dimensional. There's a functional part and a cosmetic part to it. So it always makes you think and keeps you on your toes.
Okay. What's your least favorite part?
I don't think I have a least favorite operation or things like that. I mean, I enjoy pretty much everything that I do. I enjoy the variety. There's nothing, no surgery that is, least favorite. But in terms of the specialty, in terms of things that we do, obviously, what I think most of my colleagues would agree is having to deal with difficult patients sometimes. That's the hardest part.
Mm-hmm. So do you find that there's a specific demographic that's hard to connect with? Like some physicians say millennials, some physicians say, the baby boomers. Is there a specific demographic that's harder to work with?
Harder to, yeah. I mean, I have patients from all ages, right? Because I do a lot of sort of ear paintings, otoplasty, so I see some pediatric patients for that. Mm-hmm. But I find that, for me, the most difficult demographic to relate to is probably teenagers. Usually, most of them are not very comfortable speaking. They're not very comfortable expressing their feelings. Sometimes, they're here alone. Sometimes they're here with their parents, and they can be a little bit inhibited as to what they want to say. So I find that's probably the hardest demographic. All the other ones I find pretty easy. I mean, I have 3 kids, so I know what teenage years are like. Luckily, I'm past that. I'm old enough that I'm past that. But teenagers do become humans again.
Most businesses struggle with either money, time, people, or passion. And so, which one would you say your practice struggles with the most, and which one in plastic surgery in general do you see people struggling with?
Well, I mean, luckily, plastic surgery and cosmetic surgery it pays well. So money is usually not too much of an issue. Everybody will have, rough times and not very busy times, I gather, but that's not the main area of concern as a doctor in general. So really, it would be time and people. That's the hardest thing to struggle with, because it is human relationships that you're dealing with. So you have to deal with people of all kinds of life, all walks of life, different wishes and wants. So that becomes not necessarily a struggle, but it is something that we have to deal with on a daily basis. And the other thing is time, because we work long hours, and the patients sometimes wait a little bit to see us. Sometimes we take a lot longer with a patient than we want. So I think those are the main issues in facial plastic surgery would be people and time.
Okay. Do you see more patients for cosmetic reasons or for medical reasons? Like, do you see there's one or the
Yeah,
other?
I probably see about 60% cosmetic and 40% that is non-cosmetic, and then that one is functional issues like breathing issues from the nose and cancer. I still do a bit of head and neck cancer and some reconstruction from cancer. So that is the bulk of my practice, the non-cosmetic part.
Wow, interesting.
Yeah.
So transitioning a little bit, how would your family and friends describe you outside of work?
How my friends describe me? Well, I have no idea. I hope that they describe me as a nice guy.
What do you like to do? What do you like to do when you're not working?
Well, I do like to sort of keep fit and exercise. So I do exercise, 4 or 5 times a week. I like to, I do some boxing and some martial arts that I've done for over 30 years. I play some tennis. I really I like obviously reading a lot. I've always been a big reader, but I like movies and I like hanging out with friends and going out for dinner and, having a nice glass of wine and chatting with people. So I enjoy the social thing. I mean, I'm originally from Latin America, so we are very social beings.
Where from? Where in Latin America? Chile.
Yeah.
Ah, cool.
Yeah.
So, what is your greatest passion in life, I guess? Like, what's a successful life to you?
So I like, I do enjoy my work, right? I do enjoy my work. I look forward to going to work every day, but, it is a job, right? And I'm very, very lucky that I have a job that I really love and I'm passionate about, but I'm passionate about my family, my kids, my friends, I love to travel. Those are the things that really sort of, keep me going on a day-to-day basis, and I look forward to it. I look forward to spending time with my kids in the evenings and weekends, and they're young adults now. They're starting their own lives, but we still hang out, and I cook for them, and we have good laughs and so on. And I love spending time with my extended family and with my friends. So that's really sort of the things that I enjoy the most.
So if your daughter came to you when she was a teenager and she said, I feel really insecure about, my nose or my lips or something like that, if she was a teenager now though, so in the age of Kylie Jenner and Kim Kardashian, what would you say to her? Would you advise her to, get plastic surgery? Would you say that it's a good resolution for self-esteem, or would you say, no, don't go that route, way too older?
I think obviously, as being your daughter, you have to be a little bit more careful. One has to, them better than any other patient, right? So you want to really get to the root of it. But you do have the luxury of having lived with them and having seen them grown up with you, so more or less what their insecurities are. So I would just try to get to the bottom of it. I think that cosmetic surgery in older teenagers, young adults, there's nothing wrong with it, right? There are things that are safe as long as it's safe and done for the right reasons. So putting a lid filler, and actually my daughters have asked me to do that. I have not. They have asked me to get lip fillers, and I said, well, when you have money and a job, you go get it done, girl. Right? I don't have anything against it, right? But I don't really think they need it. But my youngest daughter had a nose job done, and so she started asking for one when she was about 16, because unfortunately she did get my nose. So her mother, sort of agreed with her, and when she was a little bit older, finishing high school and so on, I had one of my professors and colleagues assess her, and then they decided to go ahead, and luckily she had a nice result, and she's very happy with that. it's something that is very hard to just say you can't do it when you're operating on a bunch of teenagers yourself that have, noses that they don't like, right? So it is just human nature. So
yeah,
I'm not against.
That's a really great answer. It's a tough question because in the media you get all this mumbo jumbo about, oh, it's bad, it's good, it's whatever. But that's a good answer, and I think a lot of patients will resonate with that when they see it. So, all right. So, what is your long-term goal? You have a family, you have a successful career. You're a senior professional. What else is there for you?
Yeah, I mean, at this point in my life, I mean, luckily I'm at that stage in my life where things have already panned out the way they should. Professionally, I've sort of kept on growing over the years and getting a better reputation, and you get certain accolades and things like that. At this point in my career, I'm traveling a little bit more to meetings and giving talks and sharing my knowledge and discussing and it's basically what it is. You're not really imparting knowledge, you're sharing knowledge and learning from your colleagues and from the attendees. So I'm doing that a lot now, and I look forward to doing it a little bit more. Now that I don't have kids at home all the time, and obviously I want to sort of continue with my career, servicing my patients and trying to give my patients the best care, learning new things, because I'm always open-minded in terms of learning new techniques and new procedures and better ways of doing things. And then, traveling a little bit more for pleasure, right? And that's really the things that I want. Nothing much more than that. I'm not a guy who's into, the latest model car, or, I need to have a yacht or a speedboat. I like food, I like wine, I like traveling. Those are my pleasures.
Awesome. So where can viewers learn more about you?
Well, I do have a website, which is TorontoFacialPlastic.com. There's a lot of information there, and there's an email form there. People can ask me questions and talk to me through that. That's probably the best resource if somebody wants to get in touch with me, to go ahead and do it through there.
All right. Thank you so much for doing this interview with me.
It's my pleasure. Nice talking to you, Lexi.